Welcome, everyone. Welcome to Community Healthcare's annual Lunch and Laughter, the brown bag version. Hey, today we are going to have some fun, and along the way, you are going to find out how community healthcare has risen to the challenges caused by the pandemic and has found new ways to serve our community. You'll also be given an opportunity to support community healthcare in its efforts to provide healthcare services to those facing barriers to care. Now, first, I'd like to give a special thank you to our presenting sponsor, Coordinated Care. Big virtual round of applause for them. Can't do it without our sponsors, and all of our sponsors help make this event possible so that 100% of the funds that we raise today can go directly to the Patient Care Fund. Please join me as we also say thank you to AmeriGroup, Kaiser Permanente, Community Health Plan of Washington, MultiCare, U.S. Bank, Brown & Brown Insurance, LabCorp, PNTA and Seattle Lives, Imedia, Host Event Planning, Minuteman Press, Pierce County Dental Society, Hilltop Action Coalition, Pierce County Medical Society, Rainbow Center, Reach Ministries, and Tacoma Community House. Big virtual round of applause for all of our sponsors. Of course, we encourage you to join us in the chat, as many of you already are. Thank you so much for that. And thank these sponsors. But right now, it is my incredibly great pleasure to introduce Marco Viniegra, the board chair of Community Healthcare, and David Flungy, Community Healthcare's president and CEO. Gentlemen.
Thank you, Jeff. From my seat as board chair, it has been an amazing year. It is a privilege helping lead this organization as the staff found ways to provide care safely to those who needed services. Since we cannot meet in person, I am unable to give you Community Healthcare's 2020 annual report, but I can give you some highlights. In 2020, a total of 45,385 patients were served through over 165,000 patient visits. Of those visits, over 41,000 were virtual. This is an increase in virtual visits by more than 40,000 over 2019. This dramatic increase in virtual visits is just one of the ways community healthcare responded to the pandemic. Over 6,000 or 4,000 or 14% of patient population was uninsured. If each of these patients were kept out of the emergency room just once in 2020, the savings to local hospitals will be almost $7 million. Plus, these patients are not saddled with medical debt since they received affordable care. 15% of our patients were best served in a language other than English. Language, like insurance and income, can be a barrier to care. Of the patients that reported their income, 88% of them are considered low income. Although anyone can come to community health care for care, we see a higher percentage of women, children, and non-white patients than is found in the broader community. In 2020, 48% of our patient population was Caucasian, 58% were women, and 23% were children. Also, 526 babies were delivered by community healthcare physicians. I am sad to report that none of them were named Marco. Thank you for attending today. We are here to have some fun and support an organization that is vital to Pierce County. Community healthcare has remained financially viable through the pandemic due to additional financing support it received from federal and community sources. The pandemic is not over yet. Your funding is necessary to help us continue our work. My hope is next year, Lunch and Laughter will be in person, and I will have a chance to shake your hand and thank you for standing with us today. Now it is my pleasure to welcome David Flengy, President and CEO of Community Healthcare.
Thank you, Marco. I want to thank Marco for his leadership and all of our board members for their stewardship during these difficult times. It needs to be noted that Marco is also a patient of community healthcare. One of the requirements of being a federally qualified health center is that at least 51% of the board are patients or the parents or guardians of patients. This keeps community healthcare focused on meeting the needs of those it serves. It is very hard to put into words how proud I am of the staff, seeing them rise to the challenges caused by the pandemic, and as our founder, Dr. George Tambera taught us, putting the patients first. But most of all, they did not give up. Instead, they built a better community healthcare with telehealth, mobile care, other new services, and even a new clinic. As we go into 2021, we have opened our foster and adoption clinic, a place where children who have experienced things no child should go through can start their road to healing. This will be the only center of excellence designated care location for these children in Washington State. In addition, we purchased the practice of Dr. William Rose in Lake Bay and are now providing care on the other side of the Narrows Bridge. I am happy to report that Dr. Rose and Dean Schreiner, ARNP, have joined our staff. We have added to the clinic pediatrician Dr. Mimi Chow and Martha Sandquist, who is providing behavioral health services. As Marco stated, we increased virtual services by over 40,000 visits in 2020. As the pandemic wanes, we will be able to use mobile services and telehealth to serve areas in Pierce County that are more remote, where transportation is often a barrier to care. The Arlington Youth Campus Clinic has also opened. In case you do not know, the Arlington Youth Campus is a crisis residential center and apartment complex operated by the Tacoma Housing Authority for homeless youth and young adults. We are one of the organizations helping these young adults build a better future for themselves. Construction of the school-based clinic at Bethel Middle School was also completed in 2020 and is now open and taking care of students and staff. When COVID is behind us, we will have grand openings, or more like one-year anniversary celebrations at these locations. All of you are invited. One of the other ways we are building a better organization is by addressing the systemic racism that exists in healthcare, in community healthcare, and in all of us who work here. The work has just started. Our friend, State Senator Twina Nobles, is here to make a statement of what we believe and are striving for. Thank you.
Both community healthcare and I believe that systemic racism and exclusion represents a public health crisis. Community healthcare has seen in their clinics the impact on people who have been marginalized due to the color of their skin, their orientation, their racial or ethnic heritage, and other traits used to vilify them. This diminishment is ingrained in many of the systems our society has created. All of us, consciously or unconsciously, carry these ingrained prejudices within ourselves. As a state senator and proud member of the community, I applaud the board, management team, and staff of community healthcare for recognizing that systemic racism and exclusion exist in the nation as a whole and in healthcare systems in place, and for recognizing that Black lives matter. We are all committed to causing positive change. From its inception, the founders of community healthcare held up diversity, equity, and inclusion as the cornerstone principles that guide it in its mission, vision, values, and utmost overarching goal: to provide the highest quality healthcare with compassionate and accessible services to all. The board of directors, the management team, and staff ask everyone to join them in taking steps to identify and dismantle systemic racism in the community and in their own attitudes about marginalized populations. as we all strive to fully realize the promise and the moral imperative contained in the principles of diversity, equity, and inclusion. These efforts must include acknowledging the impact of immigrant populations on Native peoples and that we are on the land of the first people of Tacoma, the Puyallup people. The Puyallup tribe is and always will be an important part of our community. In this struggle, we find strength in the words of Harriet Tubman, who said, "Every great dream begins with a dreamer. Always remember you have within you the strength, the patience, and the passion to reach for the stars to change the world."
Thank you so much, Senator Nobles. We appreciate your support of community health care. And of course, thank you to both Marco and David, wow, for your passion and your dedication to the work of community health care. You know, it's amazing that in the past year, with all of its challenges, community health care has been able to not only adapt, but to thrive and grow to meet the needs of our community. It is now my great pleasure to introduce you to Dr. Michael Hemming and Dr. Jeff Smith, who will share even more about community health care and what you can do to support their work in our community.
I started my journey with community health care 15 years ago. At that time, I had no idea where it would lead me. In 2006, I took a job as an interpreter scheduler at Community Healthcare. I fell in love with medicine, working with the doctors there, and particularly with community medicine. Decided at that point that I was going to go to medical school, worked really hard all the way through, and jumped at the opportunity to come to Community Healthcare for my residency program. The population of patients that Community Healthcare sees is a population with undeniable need. I love being able to come to work. I love being able to offer some hope to people who otherwise don't feel like they have it. So the goal of community healthcare is to make Pierce County healthier, and finding new and innovative ways to do that, including telehealth visits, providing new services, which includes a mobile trailer that has a health professional able to provide care to patients out in the community that aren't able to come to the clinic. The patients, they appreciate the care that they get here, and that's huge. The staff are engaged in their patients' lives, engaged in their patient care, and so we're all part of a team. It's a huge benefit to have in one location specialties, dental care, mental health care, all under one roof, because patients feel comfortable knowing that they can just come back here. I'm going to write a referral for you, just come back here. So it's been 15 years since I started working at Community Healthcare, and I've seen massive growth. Our number of patients served has more than doubled in that time. We've added a residency, new clinics, and I just can't wait to see what the next 15 years is going to look like. I'm just super excited to say that I've signed a contract with Community Healthcare to be a full-time attending doc next year, and I can't wait to get started.
Thank you, Dr. Hemming, for sharing your inspirational story. I loved watching you grow from a new employee to a trusted community healthcare leader, to a college student, to a medical student, to a resident physician, and finally to a partner family practice doctor. Serving our patients is Dr. Hemming's passion, his mission, if you will. Just like 80% of community healthcare employees who say the main reason they work here is to fulfill our mission, to serve our patients who need us most. You know, in 2019, it was reported that over 65% of all bankruptcies were due to medical debt. Besides the high monetary cost of medical care in America today, we also face lost time away from work and barriers such as transportation to appointments. A lack of health insurance disproportionately impacts marginalized people, whether that is due to poverty, disability, race, gender, ethnicity. These folks, our patients, are less likely to have insurance or access medical care. This can cause great harm. In a recent state-sponsored study, there was a 10-year difference in life expectancy between adjacent districts, one affluent and one impoverished. Health centers are designed to attack these disparities and provide great medical care to all, no matter what. I, Dr. Hemming, and our community healthcare staff work here for the same reason, to provide the highest quality health care to everyone. Your participation is needed to help us continue to do that. The Patient Care Fund helps us cover the cost of delivering that care to those without insurance. We charge a minimal sliding scale fee, but the cost of providing the care is the same regardless of the insurance status of the patient. The Patient Care Fund helps close that gap, providing payment for hundreds of our patients. Please contribute. Go to the address at the bottom of the screen and make a gift. The pandemic has hit us all hard as a society, as a clinic, as individuals, as patients. We've all been affected. Please use this opportunity to stick it to COVID and any other healthcare stealers. The need is still there as much as ever.
Wow. Thank you, Dr. Smith and Dr. Hemming, two of our heroes, for all of the work that you and everyone at Community Healthcare do. And speaking of you, I see you out there. I see lots of chat coming in. Keep that coming. Community Healthcare not only provides essential healthcare services, but they continually adapt to the times to make sure that their impact is felt where it is needed the most. You know, I can't help but wonder what the more than 45,000 patients of community healthcare would do if community healthcare was not a part of our community. And right now, here is your chance to be a part of their story. All of us need healthcare, and unfortunately, many go without. So please consider the impact that you can have right here, right now, on the lives of real people in your community. There are simply not enough healthcare resources to meet every need, especially for those who are uninsured or underinsured. And we need your support today. It's so easy to give. There it is on the screen. Visit comhealth.org/lunchgift. comhealth.org/lunchgift. Every dollar is going to make a difference. Every dollar is going to matter. And thank you so much for your generosity. So keep those gifts coming throughout our program today. But right now it is my pleasure. I'm so excited about this, to introduce you to the laughter in Lunch and Laughter. Are you ready? Ready for a little laughter? We've got a past winner of both the Seattle International Comedy Competition and the Laughing Skull Comedy Festival in Atlanta. Today's comedian has made numerous television appearances, including Comedy Central's Live at Gotham, Nickelodeon's Nick Mom Night Out, Laughs on Fox, and Inside Joke with Asif Ali, streaming on Amazon Prime Video. He has performed at many comedy festivals, including the HBO TBS Comedy Festival in Las Vegas, the Bridgetown Comedy Festival in Portland, Oregon, and the Great American Comedy Festival held in Johnny Carson's hometown of Norfolk, Nebraska. He has released 3 albums that can be heard on Sirius Satellite Radio, 24/7 Comedy Radio, and wherever you want. All you have to do is buy one. He's also the author of the book Happiness Isn't Funny. Ladies and gentlemen, put your hands together virtually and help me welcome Gabriel Rutledge.
Thank you.
I'm excited for you to be here, Gabriel. Thank you so much.
I appreciate that. Thank you so much. I was pausing for applause and I forgot there was none. Should have printed up here. Thank you, Jeff. I appreciate it. Thanks for reading my entire biography. I try to get my wife to do that every morning just to get me going, and she refuses. Thank you. Thank you for being here virtually. I've been doing comedy 20 years, but this is the best show I've ever done for community healthcare virtually. Yeah, thank you. I'm going to put that on my bucket list after I write it on there later tonight. This is great. Thanks for letting me be a part of it. I'm not dressed as nice as some of the presenters. I'm just realizing when I see myself in the screen right now. There was some suits and some ties. In my defense, this is about as nice as I can dress with this hair and beard. This is all that works for me. I wore a suit to a wedding last year. I was walking down the street in my suit. A guy driving by yelled out his window, "Good luck in court!" Yeah. And then I saw my reflection, and I was like, he is not wrong at all. It's either that or fun youth pastor. I think those are my choices. But I don't know. You can kind of tell what you look like by the questions people ask you all the time, which is why I know I look like a guy who has a lighter. I don't have a lighter. People get very upset about that, but what are you going to do? I recently lost not really enough weight to clap for. Oh, that's all right. You're supportive. It's a supportive day. I'm sensing that. Okay, you're all very supportive. It'll be back, is what I'm trying to tell you. And when I lose weight, I'm not saying goodbye. I'm saying see you later. Until next time, old friend, bring bread. You're supposed to have a fitness goal. That's what in-shape people tell me. They're like, if you set a goal, you'll stay motivated. Okay, here's my goal. I would like to be able to show a picture of myself without a shirt on and not have people call it brave. Yeah, that would be great. If I could stop empowering people, that would be a lot of progress for me. I didn't know I was. I posted a beach photo on Facebook, and everyone commented, "Good for you." I'm like, oh boy, I have good for you body. That's not what I'm going for. I don't know what my fitness goal is, because one time I was in Reno, Nevada, and a very intoxicated woman came over to me, and she said, "Just so you know, you should never lose too much weight because your head is huge." Yeah, and then she just disappeared, leaving me to ponder that the rest of my life. But I can tell by the reaction of the room, she may have had a point. I took it to heart. My doctor's like, "You should lose weight." I'm like, I've had a second opinion from a Reno bar angel. This is how I got motivated to lose weight. It was a weird way. I got an email from Amazon. And the email said, "Based on your recent activity, we thought you might be interested in this." And it was a picture of a bag of Cool Ranch Doritos. Which, yeah, I mean, honestly, I've never not been a little bit interested in Cool Ranch Doritos, but, unless you've been reading my journal, I don't know how that's your business, Amazon. Based on what recent activity? That's all I could think. It's not like, oh, I ordered a case of bean dip, so this makes sense. I've never ordered food from Amazon, ever. I think it's because I ordered an extra large shirt, and then I returned it and exchanged it for a double extra large shirt. Yeah, I believe that is when the hurtful algorithm kicked in. Amazon's like, yeah, this is the kind of customer who would enjoy chips being mailed to his home. And then 2 days after that hurtful email, just out of nowhere, Cinnabon started following me on Twitter. Okay, why? Cinnabon? Did Amazon tell you about the shirt? Am I on an internet fat list? What is happening? Cyberbullying is real, and it's pretty effective. It got me. That's the day I decided. I was like, you know what? After I get those chips in the mail, it's time for better choices. I'm trying. I just turned 47, which I look younger from a distance. I'm nice and zoomed in right now for the internet, but from Google Earth, I could be a toddler, honestly. I don't know. I looked around, I did some unofficial research. I think at 47, I think I'm like 3 years away from caring about birds. Which, that one divides people demographically a little bit, but I don't care about birds yet. It has no effect on me. But I am the right age, and one of these mornings, I'm just gonna wake up and be like, what was that? Is that a yellow-thrested warbler? How did I know that? Honey, get my vest. I sensed some of you were laughing, and some of you were like, good luck finding a warbler this time of year. Which is probably true. If I'm 3 years away from caring about birds, that means I'm 4 years away from hating squirrels. I believe that's my future. Everyone I know in their 50s just stares out their window all day. Squirrel, no! That's my neighbor all day. Get out of my bird feeder! Which I tried to tell them, they don't know it's a bird feeder. It's not really how nature works. No animal walks up to a giant pile of food suspended in the air and is like, I'm sorry, is this for me? If these are warbler treats, I'll back off. I'm hungry, I'm not rude. So just for fun, just to be a fun neighbor, I bought a squirrel feeder for my backyard. And guess who eats out of it? My daughter. Yeah, I was surprised too. I was like, we have food in the house. This is actually kind of embarrassing. I started growing my hair long when I turned 40. That was my very mild midlife crisis, but this is all the energy and money I have to work with, so that's what I'm doing. This is what I'm down to. Just screw you, supercuts. I'm off the grid. Yeah, you got to do that hair flip to let the man know you mean business. That's sort of the exclamation point at the end of a long-haired sentence. That's how you know we're done talking. Like, yeah, so your turn. It's never a smart sentence, I've noticed. It's never like, so anyway, that's when I got my master's. That's never happened, never. It's more like, so anyway, that's the day I learned you can get a DUI on a bicycle. Oh, so wise. I have long hair. I'm a little prejudiced sometimes against men with long hair. I'll admit that to you. Doesn't make sense, but it's true. I think it depends on the occupation. Okay? Long-haired comedian, fine. Long-haired cardiologist, I've got a couple of questions. If they're like, I just completed the procedure, and I think your dad's going to be fine. Is he? That one worries me a little bit. I don't really have a look that says I'm doing well financially. I was at the grocery store, and the checker was ringing up my stuff, and she got to my bag of apples, and she was like, oh, sir, I just wanted to let you know these apples are pretty expensive. I was like, wait, do I look like I don't have apple money? Like, no, I want them. I've been saving up. Like, well, I had my eye on that bag of apples for a long time. I said, someday, Lord willing, I'm taking those home with me. Today's that day. I just cashed in a war bond. Ring them up. She's like, well, they're $4 a pound. I'm like, okay, I saw the sign. I did not come here to do math, so I do not know what that means. She's like, okay, just so you know, these apples are $22.13. Are you sure you want them? And I was like, yeah. I want some of them. I'll take an apple. Not the big one. If you could put that one back, I'd appreciate it. Yeah, and that's when I sadly realized she had profiled me correctly. I'm doing all right. I don't have Honeycrisp money. I have Honeycrisp taste and a Red Delicious budget. That's what I have. This is the problem, I accidentally bought organic apples, which, by the way, rarely happens in the self-checkout. Little shopping tip for you guys. I'm just saying, if your budget's a little tight, good news, a lot of stuff looks like a banana. I've never done it. I wouldn't be able to pull it off, even if I wanted to, because I've never done self-checkout by myself and completed it, ever. People have to come help me. Sometimes they have keys and they're mad. They're like, what'd you do? I'm like, I don't know. First of all, I rang up everything bananas. I don't know how that happened. And then it said unauthorized item in the begging area, and I think it's me. I don't actually work here. I was not trained on this equipment. It's gone horribly. I don't like going to the checker either, though. I don't like that conversation. I hate if you get a candy bar, and the checker will be like, did you want me to leave this out for you? No, I don't. I would like to fish it out of the bag in my car like a fat, filthy animal. That's what I'd like to do. Put it in the bottom, make me work for it. That's why I never admit that candy bar was even my idea. I act shocked it showed up. I'm like, what? Oh, that's right. I got a friend coming over later. He loves king-size Snickers bars. He's a piece of garbage, honestly. A lot of this stuff's for him now that I'm looking at it. Could you leave the broccoli out, though? I like to munch on that in the car. I've been with my wife since I was 19, which, yeah, I did. Too long? Am I sensing from the room that's been too long? I wish we were high school sweethearts, because, that's adorable when you hear about high school sweethearts. My wife and I, we didn't quite make it. We were community college sweethearts, which kind of sounds like we were already used to not getting our first choice, is what that sounds like. Like, we'll do this relationship for a couple years, transfer to a better one, we'll be fine. But it worked out. At 23 is when I got married, that's pretty young. Young enough, all my friends were like, if you do this, you only get to be with one woman for the rest of your life. And I was like, yeah, that's better than the nobody I was working with before. That's why I hit the buy it now button. I panicked a little bit. I don't know, I've been married long enough now. I think I can say just because it's one person, that doesn't mean it's always the same. That's what I tell my single friends. I'm like, what are you into in a woman? What are you attracted to? Short hair, long hair, blonde, brunette, young girls, skinny girls, college girls, pregnant girls, moms, chubby chicks? I've been married 23 years, and my wife's been all of those. Yeah, I'm not judging. I've been a couple of them too. You pick. I'm going to do this so we don't look at anything else. My wife and I argue sometimes, which I think that's the appropriate amount to argue sometimes. All the time seems bad. Never, I do not trust. I don't trust a never. You ever met that couple? They're like, we never fight. I'm like, do you not talk? Because that is cheating. Sometimes couples will be like, you know what our secret is? We never go to bed angry. I'm like, wow. I would be so tired. I've gone to bed angry, then woke up furious. But, well-rested with fresh hate. It's a different system. It's not easy. I mean, if you're in a relationship, basically what you're saying to someone is, look, I love you just the way you are. I just wish you were different. I don't think my parents, they do not argue. I don't think my parents argue, but I think that's because my dad, he's just been okay with every idea my mom's had for 40 plus years. He's like, you got to pick your battles. And I'm like, that's true, but I don't recall you picking one. Right now you're wearing a crocheted sweater vest that she made for you. That's an example of something that could have been a battle. Not only are you waving the white flag of surrender, she quilted it for you, which is cool, but... We have 3 children, my wife and I, which is, I didn't mean to do that. I love them. I love them so much, but that's a lot. 3's a lot. We're not, whatever. They're all here now. We're not saying this one's a surprise, this one was planned. It's not their business. Maybe when they're angry teenagers. I didn't ask to be born, Dad. I'm like, weird. We have something in common. I won't say that. My son just turned 18. Quick impression of him. Yeah, he's fun. We used to have conversations. We used to have full sentences in my house. We're down to just... It's like talking to a congested goose. How was school? All right, good talk. His school's not even open, but I make him sit in the parking lot for 6.5 hours a day. Use their Wi-Fi. We're paying taxes. 18-year-old son, 13-year-old daughter, 9-year-old daughter. Not the best family planning. But whenever people hear that age breakdown, they're always like, well, that's great, because at least the 18-year-old can babysit. And I'm like, ugh, kind of. I leave him in charge, technically. But, I pull the 13-year-old aside. I'm like, look, I'm counting on you. Get your little sister over here, too. We're going to need her as well. Sometimes the ducks have to take care of the goose. That's our family code. Okay? If this goes bad, take your brother's phone. Text me, duck, duck, goose. I'm coming right home, okay? That's how we're going to work this. I don't know what I'm really doing with my family. That's why I should have taken this cap off earlier. There we go. I'll be honest. I'm the assistant manager of my family. That's my position. My wife, of course, is the manager. But, we work as a team. That's what the assistant manager does, even if I don't have the same understanding or enthusiasm for our policies. I'm a good teammate. Okay, sometimes I have to be like, look, kids, I also don't understand why it's so important to replace the toilet paper roll. But this is coming from corporate. My hands are tied. I agree with you. We should definitely pile a bunch of them on the back of the toilet. I brought that up at the meeting. That was shot down. We don't get to do that. It's very important to your mother that if we're out of toilet paper, we have to do an 8-foot crouch walk over to that cupboard. I'm giving her some grief, but thank God my wife's in charge. We desperately need her. She's so good at the business of running a family, and I am not, okay? The only reason I get to be assistant manager is I am sleeping with the manager. That's also why we have so many employees. I looked into it. I can't be fired. I'm a co-founder, so I can only be bought out. I'm not good at details, okay? And details are important, particularly in healthcare. Details are very important. If I take one of my children to the doctor by myself without my wife, it is embarrassing what I do not know about my own children. They're like, what's your daughter's birth date? I'm like, 12/21. They're like, what year? Every year. I'm pretty sure she has an ear infection. We're not going to look in there. I get a quiz. I don't like your tone. I'm going to say that. Sir, is your daughter allergic to any medication? Yeah, probably. I guess I thought you guys would write it down. What's on that computer screen? Solitaire? Look it up. Stop making me look bad. It's going to be embarrassing if we both have to call my wife about this. I like being married. I get a little nervous. I'll admit I get nervous sometimes when I see older married couples. sometimes my wife and I will go to a restaurant. We'll see that cute couple. You can tell they've been married like 50, 60 years. And my wife says the same thing every time. Oh, I hope that's us someday. And I'm like, we don't know them. We don't know one thing. Why are we assuming that they're in love? Maybe they're too weak to kill each other. We don't know that. I want to be married that long. That husband looks like the ghost of Christmas future, okay? He's staring at a menu, way too confused. Honey, do I like fettuccine? I've gotten dumber every year I've known you. Oh, makes me gassy. You always know. It happens. I've been married long enough. If a beautiful woman starts talking to me, I swear to you, first thought in my head is, oh, I don't need this. Did she send you? My wife has an amazing memory, which I don't. I do not have an amazing memory. I actually wish her memory was a little worse, if I'm being honest, because it's like living with a court reporter, except court reporters are impartial. Just our whole life, I think we're hanging out, having a conversation. She's running that stenographer machine, just and then one day I'm like, I never said that. And she's like, whoosh, I'll read it back. She gets me. I had a guy message me on Facebook recently. He was like, remember me from 3rd grade? No. Not even close, Gary. Not even close. And I'm not talking about a young guy, because when's the last time you saw a baby named Gary? It's been a while. If I see a baby Gary, I'm going to assume he can change my transmission already. That kid was born an uncle. Put him to work. There's a lot I don't remember from grade school. And I'm starting to think it's because we had the kind of glue that they don't let kids have anymore. There's some pretty blurry years. I should remember more. We could have been friends. We could have been enemies. I was in a rubber cement haze, Gary. I don't know what happened. We thought we were sober in grade school. We were not during art. The DARE officer would come in and be like, say no to drugs. We're like, yep, right after craft time. I'm going to make shiny art and think about what you said, officer. Also, what if I did remember Gary from 3rd grade? Are we going to start up our old grade school conversations? Like, Gary, did you ever become a ninja? That was your plan. Please tell me your cooties cleared up. That was a long time ago. I thought about it, okay? Gary got me thinking. I am sad to report I only remember 2 people from 3rd grade. That's it. 2. Girl I had a crush on, and the kid who pooped his pants on a field trip. That's all I remember. So unless you're Lisa Wasberg or me, I don't know you. That's all my time. Thank you very, very much for letting me be a part of your event. Please donate all your money, all of it. You don't need any more of it. Donate it all.
Wow. Gabriel, thank you so much. Man, doesn't that feel good? We all need some laughter in our lives every day, especially these days. Gabriel, thank you so much for bringing that laughter into our lives today. And we appreciate your support of community healthcare as well. Now, speaking of support, that is why you're all here today. So please keep those gifts coming. I'm seeing lots of chats coming in while Gabriel is up here making us laugh. So keep those chats coming in, keep those donations coming in. Before we wrap things up, we do have one more short word from our friend Dr. Jeff Smith.
Thank you, Jeff, and thank you, Gabriel. Before we close, I want to gently, or not so gently, nudge you one more time to give. Support community healthcare, Dr. Hemming, and all who do this work and can't do it without you.
Thank you, Dr. Smith. Now, again, if you have not yet donated to community health care, now is the time to do it. Please consider a gift of support right here, right now. You can continue to donate, of course, at comhealth.org/lunchgift. That's comhealth.org/lunchgift. Your support will ensure that they can continue their tremendous impact on the lives of so many uninsured and underinsured people in our community. Thank you again for all of your support.